Are you all exhausted with the, yeah. So today I'll just briefly touch upon this topic, which is psychological support for patients in ICU and how communication can impact their life. So when we are talking about ICU patients, we are talking about a person's journey, and as you all know that most of the ICU admissions are sudden and they are unexpected. The person doesn't, plan for an ICU admission. So what happens in such a scenario is the individual, the patient who is getting admitted is quite perturbed, quite gets anxious, he's scared, he's fearful that it is a life and death situation for him. At the same time, as much difficult it is for him, it is difficult for the family as well, the relatives. So the family, because the family is not staying with the patient, so their anxiety levels sometimes, are raised. So sometimes some of the family members can get angry, they can get irritable when the information is not being passed on to them. They get worried, they would have constant requests to see the patient or meet the patient. So I think all of you must have gone through all these scenarios, like meeting different individuals. So here when we talk about patients, so we cannot generalize all of them. We cannot generalize that all of them will go through the same process of stress. Because even for us all individuals, how we take upon a sick role is different. Let us say for one person, when they get sick, they wouldn't want more attention. They would take a tablet, they would go on with their work, they would be okay with it. But for some individuals, if we see here, they might want a lot of attention. You would want everyone to come and, ask you how you are doing and all that, so that you feel less anxious, you feel good about it. So same thing when we are talking about ICU admissions, when we see each and every person has a different way that they tackle stress. So some are very easy to handle. Some of the patients, they don't require much care. So they are very, cooperative for the treatment. They would listen to you. They would be comfortable and happy even with serious illnesses. But there are some individuals who are very challenging. So how we can try to reduce these challenges in your day-to-day life? So here, this is a quotation I have kept, which is very essential for all of us, not only with dealing with patients and their family members, but even in our day-to-day lives. We think we listen, but very rarely do we listen with real understanding, true empathy. Yet listening is a very special kind, is the most potent forces for change that I know. So here I would want to emphasize this one thing called listening. So there are so many people in the hall. So all of you are hearing, all of you are listening. But sometimes it's difficult to understand whether you have really listened or not. So what we can do? Is it that every time you're talking to your friend or with the patient, are you really paying attention, or are you just lending a ear and are you just listening? So how this listening will affect, because this is a particular sensory thing that I think from time immemorial, from our childhood also, we used to listen to stories. So it has a lot of impact on our mind, listening. So what is very important, I would want all of you to do is that spend some time, listening to the patient. No need to give your opinions or no need to give any solutions, but I think take out some time and make the patient feel that they are your priority. Should make them feel it. Let it be a 1 minute or 2 minutes. Be there, listen to them, what they have to say, and that itself is a therapy in itself. So what are the common problems that we usually face in the communication with the patient in ICU? Like I have earlier mentioned, there's a lot of unfamiliar surroundings for the patient. So they can't see, there's a lot of machines around, a lot of sounds coming, so it makes them very anxious. So the patient becomes anxious, the family gets anxious, and also based on the severity of the illness. Let us say if he's having a very severe illness where where maybe he might need to be intubated or such decisions have to be taken, it again, increases the anxiety. So this, when a person is very anxious, it becomes very difficult for us to communicate with them. So you'll have to understand how you can do that. An altered mental state. All of you must have, come across patients who are very confused, who are not alert, who must be going through this delirium phase because of so many medical issues. So they could be hallucinating, or they could be irritable, they could be removing the tubes and all that. So that again that is a barrier, in communication. Then barriers to verbal communication of the patient. If the patient is intubated and all that, maybe the patient is not able to express. And sometimes the patient can show in gestures. So how you can understand from the gestures, what the patient is feeling. And lack of time. Lack of time in the sense you are too busy, because one person is handling maybe more than 2 or 3 patients, and sometimes because of the busy ICU and all, you're not able to spend so much time with the patient to really understand, if the patient, he or she, has some other concerns, psychological concerns. So these are all the problems which can happen. So how we can overcome them? So there is something called as, have you heard of therapeutic communication? Yeah, so therapeutic communication is nothing but trying to develop a rapport, good rapport with the person, so that the other person feels good after talking to you. That is the thing. So the first and foremost here what comes is listening. So listening. See, after all your work is done, after you have all given the medical support and all the medications and everything, put up the IV fluids and all, you have some time, you have written your notes and all, I think you all will be having some spare time at least, right? Maybe 5 minutes spare time. So I think all of you have to utilize this in maybe trying to understand more about the patient. And what I mean by broad openings is, instead of asking, closed-end questions like, okay, do you have pain? It will be a yes or no question. Okay, maybe you can have open-ended questions like asking them, how are you feeling today? Can you talk to me about your family? Okay, are you concerned about your family outside? So that the patient can open up by themselves. Because there will be different age groups, so different people will have different concerns. Like if it is a young mother, the mother would have left their children at home. So maybe she is worried about how they are, whether they are taken care of or not. So you can try to, develop a rapport where you also ask them some personal questions if they want to talk about them. And then this is very important, restating. Restating in the sense, I have spoken to you, you have spoken to the patient, you have listened, or the patient has spoken to you and you have listened. But there is another aspect to it. If you repeat what the patient said, let us say if the patient has said that I feel very depressed, that I am away from the home and I don't know if I'm going to live or not. So maybe at the end of the conversation, you can again ask him, so what I understand is you are anxious that whether you'll be able to go home or not. So this repeat question of the patient's statements can make them feel understood, that really that you have listened to them and you're empathizing with them. Empathizing means that you have understood in what position the patient is, and you have tried to be in the patient's shoes and try to talk to him. So this empathizing is very important. So that you can show by restating, the patient's statements. Clarification in the sense, sometimes if you're not able to understand, instead of ignoring, like you're not able to understand what the patient is telling, maybe because of time issues or so, you ignore and you get back to on some other work. Instead of doing that, you can ask them to repeat. Can you please repeat what you said? I was not able to understand. So that will again, make them feel good that there is someone here who is talking to me, who is for whom I am important and my problem is important. They are asking me again and again. And reflection is the same thing, like you can ask them, how they are feeling. And humor, I think I have seen some of the sisters and nurses who are, quite very jovial with the patient. I think this aspect also should be included, where you can, include some kind of a humor with the patient when talking to them, that will make them feel good. And informing, like if the patient or the family member wants to know about what is being given and all that, how much ever you know, you try to just inform them the basic thing. You can brief the patient instead of telling ki, I don't know about anything. You can tell ki this is given so that your blood pressure is coming down. It will make you feel good. And focusing. So if the patient is interested in talking about a particular topic, don't end it, continue it. Like some are very concerned about after my death. Some will have those concerns, especially long stay in the ICUs and all. They might want to talk about such issues. So you can help them, and you can help them interact with the family members as well. And silence is sometimes, this is also very important. So see, you needn't give them, n number of solutions. Just being there present, and sometimes non-verbal cues. Non-verbal cues means the tone with which you speak to. A very sympathetic tone, or the touch. Sometimes touch is so very important. So, and your gestures, trying to care the patient. So those also make the patient feel that they are needed, they are required, and that comes, and it's a very good psychological support that they'll be getting. So here, what we will have to also understand is the family members, when they come to see the patient also, here also, the family members also will be worried seeing the ICU environment. Not many are used to it. So seeing the machines and so many tubes and all, wires, blood, all these injections. So some get scared. So they don't go near the patient and they get worried. So here the communication between the patient and the family members is disrupted. So you will also have to see that when the family member is coming, how are they interacting with each other? If you feel that the family member is anxious, maybe you can try to reduce their anxiety and tell that this is all to make him better. So you can talk to him if required. If there are no other infective protocols, if required, you can just touch him, and you can reassure your family member. So this is what you can also try to increase the bond between both of them, because as you know, the visits will be less. They won't be there the whole day. So whatever time they have come, you have to make both of them utilize that time well, reassuring. And these are some things which I want to say is which you do not do. Sometimes we do it. We think the patient is sleeping, or the patient doesn't know, the patient is not listening, and we talk about topics like disagreeing on treatment, like maybe what the doctors or someone have, I don't know how this patient is going to recover. They are really seriously talking about him. So let us say in the patient's presence, if you spoke about it, and if the patient gets to hear it, it's not a very good feeling for him. So try to see that no such conversations happen in the patient's vicinity or with the family members being present. And criticizing a colleague. Sometimes it happens in a hurry-burry, the shift is over and you're giving your shift to another one, you're transferring it, and you tend to say, oh, this she has not kept the drip properly, or she has not given this, I don't know what she's up to. Sometimes it happens that we vent out our feelings. So that also, these things also, make sure that it doesn't happen when the patient is present. And don't assume if the patient is closing the eyes, the patient is asleep or anything. But nothing in the patient's presence, such kind of a pessimistic talk also. Oh, the doctor has said that it's a very bad prognosis. So all these things shouldn't be discussed when in front of the patient or with the family member. And nothing you have to do to raise the patient's anxiety also. Okay, don't increase the anxiety by you, trying to make you feel as if you're anxious, you're worried and all that. All of us will be having so many other personal problems or professional issues, but it's always better that when you are with a patient, not to show about it, forget all of those and try to concentrate on the patient's betterment. That is very important. As too often we underestimate the power of a touch, a smile, a kind word, a listening ear, an honest compliment, or the smallest act of caring, all of which have the potential to turn a life around. So that itself means we all have this opportunity to actually turn a life around. We definitely have this opportunity. Not many have. And there are many people who remember their, their nursing sister for long years also, who have taken care of them. They are very much indebted to the health professionals. So I think what we can do is the same thing, just maybe little bit, try not to be very anxious, use some kind words, listen to them, compliment them if you feel that they are, improving or they're looking good. Some small acts of caring, because that means a lot to many people, though it is a small thing for us. So I think that is how we can see that we can effectively communicate with the patients and the family members, and not to create it shouldn't be like a traumatizing situation for them. And also, meanwhile, try to understand if the patient is having any sensory impairments. This is very important, because even if we are talking and all, the patient, some people will be having hearing problems. So when they come to the ICU, they won't have these hearing aids and all. Maybe they are not able to see properly. So people with sensory impairments can have a lot of psychological issues. They can feel even more disturbed. So try to find out if they have any sensory impairments, and also try to reorient the patient. Often, whenever you meet, and if the patient is in a communicative phase, you can keep reminding them about the date, the time, the day of the week, which year, where are you, which hospital. So reorienting about a time, a place, and a person, because they are in the ICU setup, they can't see the time and everything. Sometimes disorientation starts. So often reorienting will help them to be in touch with their surroundings.